order this meeting of the Minnesota Senate Health and Human Services Finance and Policy Committee. It is Wednesday, March 11th, 2026. And members, we have a full agenda today. We have 4 bills that we would like to get through. These are all bills that relate to scope of practice, professional licensing type of areas. And just wanted, before we get started, just to mention that my philosophy, my approach to these bills in holding hearings is that we have an opportunity to hear from those who are supportive of the bill, providing their information to members about why they think that this is an important bill to bring forward this year, and reasons that they have been working on it. And also, if there are people who are not supportive, if they're in opposition to the bill, to give them an opportunity to present their thoughts and concerns about these proposals. We have taken time to think about which bills are most ready for this type of hearing and made that assessment, but I just want to make sure that people are aware. Members want to understand the pros, the positives, and the support for the bill, as well as concerns. 3 of the bills we will be laying over, I think, today. So, they will be remaining in the committee, and we will continue to have, continue to have discussions in the background about them. And even the one that, if it does need to pass out of the committee, this isn't the end of discussions about these bills. So with that, we have Senator Hoffman has 3 bills up today, and welcome to the committee, Senator Hoffman. And first you have Senate File 962, which is the Athletic Trainers Scope of Practice Clarification Bill.
Thank you, Madam Chair and members. And there is an author's amendment, if you could have that moved and put into the
yes,
form of the bill that I really want.
Great. The A1 amendment is in your packets, members, and Senator Mann offers the A1 amendment. All those in favor, please signify by saying aye. Aye. Any opposed? The A1 amendment is adopted. Senator Hoffman.
I almost said aye, Madam Chair.
Yeah.
I still think it's nice to be back. Members and Madam Chair, I'm excited to present the Senate File 962. It's a bill that modernizes the Athletic Trainers Practices Act. And thank you for taking the amendment. This language reflects the suggestions from the other health professions in conversations about this bill. It's been a long time coming. This Practices Act just hasn't been updated since it was first signed into law in 1993. ATs, athletic trainers, treat patients with emergent, acute, and chronic injuries and non-orthopedic conditions across the lifespan. What this bill does is it creates the formal definition for athletic training and changes the term athlete to patient throughout the Practices Act. The bill does not discontinue the supervision of ATs by physicians or change the 30-day access that was created in 1993. And Madam Chair, there's 41 states that already define patient populations as individual patients or physically active persons. A patient with an ankle injury that is seen on the court is no different from one seen in the clinic, and our statute needs to update that. And so the other thing, Madam Chair, is the ATs no longer just practice on the sidelines. They're in our clinics, hospitals, and physicians. Every orthopedic doctor that I had in the last 8 months, it has been assigned an athletic trainer to be the person that was in charge of my care. So I think it's due time. I really do, because they do more than just the sidelines. So, Madam Chair, with that, I have some folks that are here to talk about the bill.
Thank you. Welcome to the committee, and I'm not sure who would like to go first. Okay.
I'll go first. Madam Chair and members.
Please, if you could state your name for the record.
Yes, my name is Troy Hain. I'm with the Minnesota Athletic Trainers Association, and here in support of Senate File 962. We are healthcare professionals educated across the spectrum of care, ranging from prevention, emergency management, diagnosis, treatment, rehabilitation, and return to activity of acute and chronic orthopedic as well as non-orthopedic conditions. My athletic training education has prepared me to treat patients across the lifespan in emergency situations, including a life-threatening event on September 3rd of 2021. Near the end of the opening game of the football season, the Waseca head football coach collapsed just feet in front of me. I rushed to his side to begin the primary assessment when it was evident he was not breathing normally and his heart was not beating. The athletic trainer from the opposing sideline rushed over and grabbed the AED, which was on the sidelines as well, and another nurse that was in the stands to help provide care. The AED was applied and a shock was given roughly 2 to 3 minutes after its collapse, and the patient was conscious and alert when the ambulance arrived. Just 1 week after that incident, another athletic trainer helped a color guard member when he went into cardiac arrest as well, prior to a game. Even though I've been trained to treat all physically active people across the lifespan, technically under our statute, neither that coach or the color guard members' lives that were saved would meet the definition of an athlete. This bill creates a formal definition of athletic training and changes the term athlete to patient throughout the Practice Act. The definition comes from the Strategic Alliance of the BOC, the KD, and the NATA, as well as conversations with other healthcare professionals. The outdated terminology continues to limit patient access to athletic trainers. Minnesota is one of only 8 states that still defines patient populations as athletes. Our Practice Act has not been updated in 30 years, and the minimum education required today is a master's degree from an accredited program. We no longer work just in secondary schools or with athletic teams. You'll find us in clinics with companies like Amazon and Delta, and even with the Minnesota Department of Corrections. The National Athletic Trainers Association supports the proposed bill, as does the Board of Certification and the Commission on Accreditation of Athletic Training Education. The MATA has consulted with the Board of Medical Practice, who takes a neutral position on the proposed bill regarding its ability to regulate athletic trainers in Minnesota. In your packets, you'll find letters of support from different healthcare professionals, schools, programs, employers, sporting teams, and more. And thank you for your time.
Thank you. And now, Dr. Cowdery, you could please state your name for the record and begin your testimony.
Good morning. My name is Dr. Diana Cowdery, and I'm a board-certified family medicine and sports medicine physician. I'm a team physician for the University of Minnesota and the Minnesota Twins, and today I'm here on behalf of the Minnesota Athletic Trainers Association and in support of SF 962. In Minnesota, athletic trainers and physicians work together in a trusted partnership, and all athletic trainers practice under the physician licensure. Athletic trainers are educated and board certified to work in many settings, including physician clinics. We trust them to take care of our athletes while on the court, field, or ice, managing not only athletic injuries such as fractures, lacerations, concussions, but also non-athletic medical problems like mental health, allergic reactions, chronic conditions, cardiac arrest. They are always the first to handle any medical problem an athlete has. Unfortunately, current law prevents them from taking care of these same individuals outside of a sports setting. Athletic trainers have the skill set and knowledge to evaluate and treat these individuals, both on the field of play and in a clinic. All Minnesotans deserve the same access to these highly skilled healthcare professionals that Olympians such as Abby Murphy has. Abby is here today in support of the athletic trainers who have helped keep her on the ice. As a patient, I have also directly benefited from the skill and expertise of athletic trainers. I've experienced my own orthopedic injuries, and the athletic trainers I work alongside were always there for me, dealing with everything from postoperative pain to rebuilding my strength and mobility after multiple surgeries. With their skill and knowledge, I could not have returned to the activities that I love doing. Updating the Athletic Training Practice Act will allow athletic trainers to more fully contribute across all settings without the unnecessary legal ambiguity. This means better care coordination in clinics, stronger coverage for athletics, and more effective employee health programs. Athletic trainers can improve the care we deliver to all Minnesotans, whether they are considered athletes or patients. Please consider supporting SF 962. Thank you.
Thank you. And there's one other testifier who signed up, Landon Fan. Is he here? Okay. Welcome to the committee. If you could please state your name for the record and you can begin your testimony.
Thank you, Chair. My name is Landon Fawn. I'm from Austin, Minnesota. I go to Pacelli High School. I am an athlete myself. I play baseball. And when I was reading over this bill, as they've stated, this is covering more than just athletes. This is showing that these physical trainers could be lifesavers for anyone in these sports settings. This is necessary for safety and the well-being of our players. And as an athlete who has experienced severe injury, I think it's time that we recognize these professionals for all that they do. They not only help with like sprained ankles or muscle strains, they save people's lives. And for far too long, policy hasn't acknowledged that, and I think it's time. We've seen a change in what can happen on the field. There are significant events that I've seen. There are lives that have been saved because of these professionals. And I think it's time to recognize that, and this bill does exactly that. I think it's absolutely necessary, not from a professional perspective, but from an athlete perspective. Someone who this could potentially impact. And I think this really makes sure that the people providing this care are given the proper training as well as the proper procedures from professionals in order to administer the care. So thank you.
Thank you. Thank you for providing your testimony. Members, do you have questions? Senator Utke.
Thank you, Madam Chair. And well done, young man. To come up to the testifier's table like that, you did very, very good. It's good to see you. I'm glad young people are participating. But I do have a question on the bill. We go to page 4. And it adds in for the out-of-state groups, you know, whether it's sporting, whatever, that are coming to the state currently. Do their athletic trainers, are they restricted or what they can do withheld because of our current Minnesota licensing?
Senator Hoffman.
Madam Chair and Senator Arkey, I don't know the answer to that. Can I dial up a friend? Because I know there's always there's a reciprocation.
There's a few people behind you that have been shuffling.
They
so
shaking their head? Are they shaking their head at you?
Thank you. Welcome to the committee. If you could state your name for the record, and then you can answer the question.
Yes, thank you so much. My name is Kate Tabor. To answer your question, Senator, the purpose of adding the applicability clause is to help ensure that athletic trainers that come to Minnesota with their sports teams or with individuals that they are taking care of from a sports standpoint are covered under our law. So we have a lot of professional sports teams and others that have teams that participate outside of the United States. So the MLB, NBA, NHL have teams that are in Canada and have athletic trainers and sports physiotherapists that are in that setting that come to the state of Minnesota with their sports teams. And we want to make sure that through this language that they are covered and appropriately practicing under their appropriate credentials while they're in the state of Minnesota.
Senator Utke.
Thank you, Madam Chair, and thank you. And I guess for clarification is, are we currently restricting anybody? You know, I like this. I mean, we want to make sure that they're all covered and are eligible to do their job. But I would be I would hate to hear that we are currently saying that whether, you know, in multiple sports we have teams in Canada coming to the U.S. to play. Are we restricting anybody?
It's currently not.
Go ahead. And can you state your name again, please?
Yes, ma'am. Kate Tabor. It's currently not written into the law, so our current statute does not have any provisions for that. What it currently states is that you must be certified by the Board of Certification, which is the United States Credentialing Board. And so the reason we put the language in there is because it is not there. And so we wanted to make sure that it was clear in state statute.
Senator Utke.
Thank you, Madam Chair, and thank you. It's too bad we have to do stuff down to the last word, but I fully appreciate it so that we don't disrupt teams and others that come, because we have other performances and other things that come from outside our borders, and so this is good. Thank you.
Thank you. Senator Abler.
Well, thanks, Madam Chair. And so Senator Hoffman, have the physical therapists decided to go neutral on this? They're supported? I just want to say all left, so maybe they had to go get coffee or something.
Senator Hoffman.
Thank you, Madam Chair. Do you remember 12 years ago, the ongoing debate on that? This is the first time when Josh Nye is the person that represents a physical therapist, and he connected with the folks over here. They're remaining neutral on this, Senator. That's the first time ever. So there's peace in the valley. That's what you used to say when you chaired a committee. So, yeah, it's good. This is really good.
Yeah, I'm happy
Senator
to hear.
Abler.
And Madam Chair, this is past time for this, and I think it's an example where as the groups can work together and try to figure out some way to accommodate the value of each makes some sense. So thank you. I'm happy it can be done. I've got a son and a daughter-in-law who were athletic trainers, and now they're a surgeon and a physical therapist. But this was I appreciate the value of the profession. I'm glad they can go up another notch. Thank you, Madam Chair.
That's huge.
Thank you. Any other comments? Senator Liskey.
Thank you, Madam Chair. Senator Hoffman, as I know you can figure this out, I'm working on an amendment for your bill. It's a small change that I think has to do with a lot of other professions. It's already language that's in a lot of the other statutes related to other professions. Under the amendment, the way it's currently written, it's line 1.17 on the amendment. It says assessment, evaluation, and diagnosis. I was just asked by multiple different professions that are in a similar space, basically to add the language performed within the professional training and experience provided by an approved education program and included in an athletic trainer credentialing examination. So it would just be to include language protecting the education side of the component, which is allowing you to diagnose under what you're educated already for.
Senator Hoffman.
Madam Chair, and the good doctor from the southern boundaries. Thank you, got that. If you look at subdivision 6A, I think that language, if you look at starting on line 1.4,
okay.
You're within is in there. Does that, if you take a look at that, that should cover what you're saying, Senator Liskey?
Sure.
On the A1 amendment.
It's the A1 amendment?
Yeah, starting at 1.14.
Okay. Perfect.
Is that?
All right. I appreciate that. I think that does cover it. Thanks. I just missed that part in the change on the amendment. So we're good.
Dr. Liskey, I thought he was going to try to stump me on this one. You know, that's.
Any other questions, comments? Well, seeing no others, I do appreciate all the work that has gone into this. Obviously, it's been many years of discussion, but I appreciate all the work that went on this year to socialize and to bring forward, changes or modifications so that the bill is, in the state that it's in now. And this is one that we will lay over. If there is more conversation needed, we can have that. Senator Hoffman, any final thoughts?
Thank you, Madam Chair and members, and I just want to reiterate all the doctors, Dr. Norberg, Dr. Caravano, I could list them, everyone that was by the bedside were athletic trainers. And so this is an important piece of work that they do, and I appreciate you hearing this, and I appreciate you laying this over. Thank you.
Thank you. And Senate File 962, as amended, is laid over. And next, Senator Hoffman, you have Senate File 1131.
Thank you, Madam Chair and members. I believe there's a couple of authors' amendments to this one as well, unless I'm reading into somebody else's.
Senator Hoffman,
Yep.
So there's the A2 amendment, which basically supersedes or replaces the A1. Is that the one that you wish to move forward with?
Yeah,
A2?
Madam Chair and members, if that delineates the A1 and the A2 just can be by itself, absolutely.
Okay.
Unless Senator Abler wants to add his amendment to this, but
Senator Abler.
A2 is the one I was hoping you would accept. So. The A2, just so you understand what the A1 does. I don't know what the A1 does.
Senator Abler.
Okay.
Go ahead.
Oh, sorry, Madam.
I must be back.
The A1 appeared to be similar to the underlying bill.
Yep.
And I'm not sure of what additional, language was in it, but the A2 is separate and would replace that. I mean, they can't be both adopted, so.
No, just for disclosure, Madam Chair, if I may. The A2 moves it to a voluntary registration, which I believe the other body has moved forward with. The A1, whatever the details there are, is mandatory licensure. And so, personally, I mean, I think if we want this bill to go anywhere, it would be well to adopt the A2, but just so members know what choices are on the buffet of options. So, thank you, Madam Chair.
Senator Hoffman, so you would like to move as an author's amendment the A2?
Yeah, Madam Chair, and that, for your information, Madam Chair, if the A2 is adopted, then that takes away all the arguments that you're going to hear up here, so you really don't have to have a 45-minute debate about the A1. That absolutely cleans it up and matches. I don't think we should match the other body, but in this case, I'll relinquish to the matching the other body.
Okay, let's take care of that. So Senator Abler offers the A2 amendment. Members, all those in favor, please signify by saying aye. Aye. Any opposed? The A2 is adopted. Senator Hoffman.
Thank you, Madam Chair.
You can present your bill.
Thank you. With that, what really is, there's 108 local ordinances across Minnesota, and each city sets its own rules for training requirements, licensing fees, and background checks. This is another one of those debates, Madam Chair, that has been around for years. And if I'm going to Dr. Liskey's chiropractor clinic and I'm a licensed massage therapist, but I have to go and get my regulations in whatever town, Long Prairie or Lonsdale there, or I go up to the Halloween capital of the world and I work out of somebody else's chiropractic clinic. Each one right now, Madam Chair, really sets the regulations that are happening there. And so screening standards vary differently, and if the license is denied and invoked in one city, an individual can simply relocate and practice in another. It just creates enforcement gaps. We always thought, and you were part of this conversation for many years as well, there should be some consistency. There should be, like we have the Board of Cosmetology that oversees people that do hair and nails and stuff, right? And that was the same argument here. It does not restrict other therapies regulated under Chapters 146A. With the Abler Amendment, it's made it clear it's now voluntary versus mandated. So I think that argument is pretty much out the door on that. But, you know, this is not about creating new barriers. It's really about modernizing. This is what you're doing. Your scope of practice is modernizing the regulation and protecting the public, and really aligns Minnesota law with professional standards. Thank you, Madam Chair, for hearing this bill. With the A2 amendment, I think this just pretty much takes away anybody's argument on that, and it should just be something. I don't know what you're going to do with this disposition-wise.
Senator Hoffman, this bill needs to go to the Judiciary Committee, so that's where we will get to when we get to that point.
Thank you.
So would you like me to go to your testifiers?
Yeah, you can go ahead, and I think, again, the A2 amendment pretty much takes wind out of a lot of arguments on that, so go ahead.
Excuse me. First, I'd like to call up Rachel Romanelli and Ellie Larson. Welcome to the committee, and Ms. Romanelli, if you could state your name for the record and begin.
Yes, thank you. My name is Rachel Romanelli. Thank you, Chair Wickland and members of the committee for hearing Senate Floor Bill 1131. I've been a licensed massage therapist for 29 years, holding my license in Washington State, and I'm also a nationally board certified massage therapist. I've lived in Minneapolis, Minnesota for 14 years, and I've been in a medical office that entire time. And actually, when I first moved to Minnesota, I was hired by United Hospital and worked in inpatient massage therapy there. Because I have a state license and national certification, I was able to be credentialed to provide massage therapy to 11 hospital units, including ICU, cardiac rehab, surgical floors, and birth center. I also serve as the Government Relations Chair for the American Massage Therapy Association Minnesota chapter. I'm going to just share a few statistics with you to keep in mind as you hear my testimony and others today. Starting with, there are 45 states in the U.S. that mandate statewide regulation for massage therapists, and Minnesota is one of 3 states without mandatory regulation, along with Wyoming and Kansas. We have 2 additional states, California and Vermont, that regulate with optional registration or licensure. And here in Minnesota, there are 856 cities. 108 cities currently regulate massage therapy through local business ordinances. And as Senator Hoffman said, they do vary widely in requirements, fees, enforcement, and education. Within Minnesota, between 3 professional organizations, we estimate there to be approximately 5,000 people that are practicing massage therapy and Asian bodywork therapy. Minnesota currently also has 14 massage therapy programs, all teaching educational programs at 600 hours or more, which is aligned with the national education and training standards. These schools collectively graduate between 300 to 400 massage therapists every year. Massage therapy is already integrated into healthcare. Massage therapists are working in hospitals, hospice care, rehabilitation programs, wellness clinics, and medical clinics. Senate File 1131 with the amendment provides an optional registration system that creates a pathway for professional credentialing within the state. And this allows those who wish to meet education and professional standards the opportunity to do so and participate more fully in healthcare systems. Without that pathway, barriers remain for massage therapists and for the public seeking access to qualified care. So what we're really discussing today is not creating a profession through regulation. The massage therapy profession already exists. What we're asking for is the opportunity to recognize, support, and responsibly regulate a workforce that is already serving thousands of Minnesotans every day. The future of massage therapy within healthcare is already here, and Senate File 1131 helps Minnesota move forward with that future. I urge you all to please pass this today. Thank you very much for your time and consideration, and I will be available for questions. Thank you.
Thank you. I also wanted to make note that we have a large number of testifiers signed up, and so I would like to make sure that if everyone can stick with about 2 minutes of testimony, that would be appreciated, because we do need to get through this bill and then 2 more. So please state your name for the record, and you can begin.
Thank you, Madam Chair and members of the committee, for the opportunity to speak. My name is Ellie Larson. I'm the Massage Therapy Program Chair at Northwestern Health Sciences University. I've been a practicing massage therapist licensed in the state of Iowa for 24 years, and I am board certified. I've been an educator for 8 years. Living just across the border, I have seen untrained individuals come to Iowa and share stories, and that is what I want to talk to you about today. Opponents of this bill will argue that requiring education to practice massage therapy limits people's personal freedom to participate in manual therapy profession. But I ask you to consider the opposite. Without formal education, a person should not be allowed to touch the public in a healthcare adjacent profession. And I want to share some situations, examples of harm that illustrate why. The first, a pregnant woman sought massage for swelling and headaches. These are clear warning signs of preeclampsia. This untrained individual gave her a full circulatory massage, not recognizing the danger. By the next morning, she went into preterm labor and required emergency transfer for immediate delivery. A trained therapist would have recognized this contraindication and referred her to her primary. Clients on anticoagulants require modified techniques because certain massage strokes can dislodge a clot. Untrained providers may not even ask about medications or health history. Trained therapists are taught to adjust pressure, avoid certain strokes, and recognize when massage is unsafe. And finally, a client received deep friction work directly over the ulnar nerve at the elbow, which is an anatomical endangerment site where nerves and blood vessels are especially vulnerable. Because this provider was untrained, they applied aggressive pressure over the tendon sheath, damaging the nerve so severely the client required surgery. Their hand function has never fully returned. A trained massage therapist knows exactly where these structures are, how to avoid them, and how to modify touch in vulnerable pathways. These are not rare stories. These are predictable outcomes of allowing untrained individuals to practice without standards. Massage education is not just about technique. It's about understanding anatomy and physiology, scope of practice, contraindications, medication interactions, clinical reasoning, and ethical decision-making. This is what protects the public, and this is what separates healthcare professional from someone simply using their hands. Good intentions are not enough. This pathway offers an opportunity for people entering healthcare as a massage therapist to demonstrate their dedication through education that keep clients safe. The desire to help must be paired with training to do so safely, and the public deserves assurance from the state that anyone practicing has met those standards. I urge you, for public safety, for professional integrity, and the future of healthcare in Minnesota, to vote yes on this bill.
Thank you. And now I'd like to call up Jackson Petersburg and Carrie Borchard. Welcome to the committee. If you could please state your name for the record and begin.
My name is Jackson Petersburg, Madam Chair, committee members. I've had a private practice as a massage therapist in Minneapolis for the past 47 years. My practice, specializes in anatomically precise structural techniques that address common soft tissue injuries and conditions that may involve muscles, tendons, ligaments, and fascia. I co-founded and co-directed Centerpoint Massage and Shiatsu Therapy School and Clinic from 1985 to 2022. I directed the Western programs at the school and also developed and taught advanced anatomy and rehabilitative massage therapy techniques. I've also taught advanced techniques classes throughout the country. In 1983, I co-founded the Minnesota chapter of the American Massage Therapy Association, where I also served as chapter president. In addition, I served as district representative for the AMTA and as a board member of the AMTA Council of Schools. Finally, I have assisted the cities of Minneapolis and Bloomington in constructing their ordinances for massage therapy. I've acted as a consultant for companies that are establishing a therapeutic bodywork component to their businesses. And I have been an expert witness for Hennepin County in prosecuting massage therapists for criminal boundary violations and private law firms dealing with potential physical harm allegations. I'm here to express my support for SF 1131, legislation that would establish statewide regulation for massage therapists and Asian bodywork therapists in Minnesota. After spending my entire career in this field, I've worked closely with fellow therapists from around the United States and in other countries, trying to establish a rigorous code of ethics, unified educational standards, a nationally recognized certification exam, and an accreditation agency to approve massage and bodywork curriculum standards, and a research foundation that supports the growth and validation of manual therapy techniques and their effects. I'm sorry to say that Minnesota is one of the very few states that does not currently have some form of statewide regulation to regulate the profession. Instead, Minnesota practitioners operate under an onerous, inconsistent, and at times discriminatory system that is unfairly linked to the massage parlor industry. This patchwork of municipal ordinances creates unnecessary administrative and enforcement burdens on cities, conflicting licensing requirements, and requires practitioners that work in more than one municipality to be separately licensed in each city. No other healthcare profession that I am aware of is required to operate under such a fragmented system. While most of the states in the country are working towards a unified regulatory model that will allow practitioners to seamlessly move and work to other states, Minnesota is operating on a system that is costly, restricts portability, and frustrates the practitioners, municipalities, law enforcement, and consumers. SF 1131 would replace the existing fragmented system with a consistent statewide regulatory structure that provides clarity for practitioners, municipalities, and the consumer. Establishing statewide standards helps ensure that practitioners meet minimum educational standards, for example, in the sciences, techniques, professional ethics and boundaries, business practices, and a supervised clinical experience. They adhere to a clearly defined scope of practice and are accountable to an oversight body that can address ethical violations, other potential forms of harm, and take the appropriate disciplinary actions when required. In addition to improving regulatory consistency, FS 1131 recognizes massage therapy as an evidence-informed, non-pharmacological component of today's integrative healthcare environment. Adopting statewide regulation would align Minnesota with national professional standards and bring our state in line with the vast majority of the country. For these reasons, I respectfully ask for your support of SF 1131. I'd be happy to answer any questions you may have when appropriate. Thank you for your consideration.
Thank you. And Ms. Borchert,
Hi.
please state your name for the record and you can begin.
My name is Carrie Borkhardt. I am a child and adolescent psychiatrist. I am testifying in favor of massage therapy licensing as a person with lived experience. In 2024, while staying at Madden's Resort near Brainerd, I got a massage at the Madden Spa. During that massage, the male massage therapist sexually assaulted me. Massage is a very vulnerable situation. People are naked, drowsy, and may fall asleep. My reaction when I realized I was being assaulted was to become a rabbit and freeze. While that is very common in this situation, it also left me with shame and embarrassment. I have done everything I could to prevent this perpetrator from assaulting anyone else. I reported it to Madden's, who immediately suspended him. But there was nothing to prevent him from going to Grandview or some other spa. I filed a police report with Cass County Sheriff's Office. Cass County has no massage therapy licensing. Cass County declined to prosecute my case because there was no tissue, which is usually the case with this kind of sexual assault, and because he denied doing it, even though the perpetrator admitted to the investigator that he had sexually touched multiple women during massages and estimated that 4 women per week gave him a signal that they wanted sexual touching. I also filed a complaint under Minnesota Statute 146A with the Minnesota Department of Health. The investigator at MDH told me they don't have good tracking of perpetrators who move about the state because the 100+ jurisdictions do not communicate well with each other. Further, he said sanctions are limited by a law that, quote, has no teeth, unquote. He told me that Minnesota needs a massage licensing law. In my personal experience, what we have now doesn't work. I'm willing to answer any of your questions, and thank you so much for hearing my story.
Thank you. I appreciate your sharing. Members, now we have testifiers signed up, Barbara York and Petra Brocken. I'm sorry if I mispronounced your name. And Ms. York, if you, I've just got you down first on the list. Ms. York, if you could state your name for the record and begin your testimony.
Yes, Madam Chair. My name is Barbara York. I have been in practice since 1983, 43 years, and have been following city and state regulation attempts since 1987. Prior to Jackson Petersburg being president of the AMTA chapter, local chapter, the president with the AMTA and I sat down with, in your packet, it's the second page, with the 214 regulation law that says you have to prove harm, not remote, not potentially. Any harm that's been discussed here has nothing to do with massage therapy. We are not allowed to diagnose conditions of our clients. They are responsible for themselves, essentially. And that is made clear in the 146A when we talk about our boundaries. I have also been down to Rochester asking them not to put in their massage quotation marks. Every time that is done, all these years, we have been working with people who think that they can deal with the vice world by regulating massage therapists. It cannot be done. In your packet, you have a letter from the Minneapolis talking about the business license that they put in place, and that changed so many things. It's a two-part, and they have translators, so nobody can bring in a person and have a speaker for them who, gets them through the process. They've been able to sort out. What the state needs is to work with the Minnesota advocates for human rights. They have been working with sex trafficking issues. They know what they need, and it's not a massage license. If you look at the back of the packet from the MTMN, there's 2 pages from the ABMP and the AMTA. They do great harm to the people in the state when on their website pages they say there is no regulation in the state of Minnesota. If I were a member of either of these, I would sue them for misinformation. The person who was unfortunately abused while on a massage table, the people that talked to her did not know about the 609 that's on the front of our history that we passed. We, the people and practitioners and citizens of Minnesota, pass these laws. You have people here from national groups who will benefit from having licensure go through. Registration is simply a baby step. We've seen this in other states. Wisconsin passed a law that was a licensure. Now they're working on passing a business license, separating us from as massage therapists. There's no such thing as an illegitimate massage therapist. There's the sex trafficking, human trafficking, prostitution, however that's been modernized, that is a problem for us.
And if you could complete your testimony, please.
I will round up. So, sorry, I've got so many papers here. We are a non-invasive practice. We do not harm. The insurance companies do not have payouts because, especially there's noted, there was a neck injury. It's probably under a chiropractic move, which has a license of its own. If we stay in our lane, as massage therapists, we do not do harm. There is punishment for doing anything outside of massage. And sex trafficking is not our problem. It's the state's problem. And that can be handled completely differently with business licenses, regardless of what practice is being done in any city. And Minneapolis is the model. Please oppose this bill. Thank you.
If you could please state your name for the record and begin your testimony.
Thank you. My name is Petra Broken, and I'm a Minnesota attorney. I also am a board member of the Minnesota Natural Health Coalition. I'm here also in opposition to this bill. I've heard some testimony about how other states do things differently, and I would submit that that's not an argument here because we have laws that the other states don't have. We have 146A and we also have 214, which really sets forth the legal structure for lawmakers. So whether or not some other state does it differently is not really an issue. The issue is are we following the law here? So the analysis does need to happen under 214 and 146A. The other issue, one of the other issues by the proponents of the bill is the Madden's issue, whether or not someone has enough protection. We have a very specific and lengthy criminal code. In another life, I was a public defender, and I'm very intimately aware of the criminal code, and we have many ways to deal with a crime such as sexual touching by a massage therapist. Not only is it regulated under 146A, which prohibits it, but it's the actual criminal code that needs to deal with this. There's laws against sexual abuse, against criminal sexual conduct, against sexual trafficking, against prostitution. There are ways of keeping people who are sexual predators from being in the public for more lengthy periods of time. We are not without laws for this. An additional registration for massage therapists is not going to change that. I'd submit that that what should have happened at Madden's is that a prosecutor should have charged that out, and that person would not have been able to be a massage therapist anywhere. So one of the things that that you have to look at is whether or not there are actually laws against this already. So clearly there are extensive laws in Minnesota. In terms of the stories about the untrained providers and damage to people, of course, those are all terrible stories that shouldn't happen. Those are not stories I heard before I was in front of the House when this was argued or discussed, the House bill, and those stories were not brought up at that time. So they appear to have happened in Iowa. Although it's terrible, it doesn't sound like that's happening here, and that seems like a remote possibility that, again, would not be solved by anything here.
Ms. Brocken, if you can complete your testimony, please.
Yes, thank you. I just ask that 214 and 146A be looked at before anything is passed here. Thank you. And there are amendments possible to deal with, to 146A, to deal with the patchwork quality of what's going on here. And that could be dealt with an amendment for the what do you call it, the education of the massage therapists and Asian body workers. Thank you.
Thank you. And now we will go to we have testifiers who are on Zoom. First, I have Leo Cashman. And again, I would ask that testifiers on Zoom, if you could please hold your testimony to 2 minutes. Mr. Cashman, please state your name for the record and begin.
My name is Leo B. Cashman. I'm a co-founder of Minnesota Natural Health Legal Reform Project, and we're a tax-exempt nonprofit that was formed in the mid-1990s in response to a crisis that we had here in Minnesota of some of our unlicensed practitioners being charged with the practice of medicine without a license, even though there were no patient complaints driving that, and none of them were claiming to be practicing medicine. But the vulnerability they had under our state statute was that the definition of the practice of medicine is so broad that anybody trying to help somebody be healthier or prevent illness, improve the way they feel, could be charged with practice of medicine without a license. And so the remedy that became clear was, shouldn't there be some kind of an exemption to that statute for those unlicensed practitioners who stay within boundaries, reasonable boundaries for what they should be doing. And also the legislature pushed us towards adopting some ethical guidelines that the practitioners would be subject to. So after several years of working closely with the legislature, with leaders, a compromise bill was passed into law in year 2000, and it had both the health freedom aspects of allowing these practitioners to practice under reasonable limitations and with being subject to ethical guidelines. And we believe that the statute, which is called 146A, has worked out very well over the last 25 years. And basically, the massage therapists, of which there are about 5,000 of them in Minnesota, have prospered and done well with a level playing field without any recognition of some of them are by the state, that some of them are more highly qualified than others.
Mr. Cashman, if you can please wrap up your testimony.
On the other hand, of course, it's fine that there are massage therapy schools providing what they do. We feel that the present situation is excellent in terms of protecting the public and providing maximum choice to the consumer. So we stand opposed to Senate File 1131, even with the A2 amendment, and urge that you vote no on the bill. Thank you.
Thank you. Next, I have Jerry Johnson. If you could please state your name for the record and begin your testimony. And again, if we can keep it to 2 minutes, please.
Yes, thank you, Madam Chair and members of the committee. I'm Jerry Johnson. I'm testifying in opposition to Senate File 1131. I'm a co-founder of Minnesota Natural Health Coalition, and we were instrumental in educating toward the passage of Minnesota Statute 146A, which ensures that all practitioners offering services that do not cause a significant risk of harm can legally practice. We believe the criteria for whether government is involved in the right to practice is whether there is risk of harm to the public. Even though this bill has been amended to become registration, the pattern nationwide is that registration bills quickly evolve, oftentimes in a few years, to mandated licensure. So given that understanding, if that should happen, imagine that you are a practitioner of a healing art that involves touch. You have decades of experience helping people restore wellness. Then imagine that licensure is mandated and suddenly doing your hands-on work is illegal. Suddenly you could be arrested and criminally charged for giving a massage or doing any therapy that involves touch. Perhaps you cannot afford to go back to school. 625 hours of training costs many thousands of dollars. Imagine that the type of hands-on work you do is very different than the training offered by conventional massage schools. Perhaps you utilize indigenous, Native American, hands-on healing methods, or Hmong traditions, or Somali, or African American, or Latino. Yet licensure would require you to add on 625 hours of conventional training to your own unique experience, or risk criminal prosecution. If licensure is enacted as this bill is written, it will affect many practitioners beyond what we think of as massage. Indeed, the bill is so broad that if it becomes licensure, it will impact practitioners of any type of hands-on healing. All the people that do healing touch, or craniosacral therapy, or acupressure, anything that involves touch or even energy work. We believe that government should only be involved in an occupation if there is a risk that the practice causes harm to the public. We urge you to vote no on Senate File 1311.
Thank you. Next, I have Mary Jo Majerus. If you could please state your name for the record and begin your testimony.
Good morning, Madam Chair and members of the committee. My name is Mary Jo Majerus. I have been a massage therapist in Rochester since 1987, 39 years. I owned Healing Touch Spa for 38 years, and I also own Massage and Spa Professional Academy, licensed through the Minnesota Office of Higher Education. I am deeply familiar with this profession and the requirements necessary to bring highly qualified, compassionate professional practitioners into practice. A claim that there is no recourse for clients who are sexually abused by a massage therapist is not correct. Unfortunately, I have a personal experience with this matter. One of the massage therapists employed at my spa sexually abused at least 2 of our clients. The abuse was reported to the police. The therapist was charged, tried, and convicted, and is currently serving a prison sentence. For 39 years, I have hired massage therapists from many different schools in Minnesota, Iowa, and Wisconsin. And with the exception of graduates from 2 schools other than mine, have had to retrain every one of those graduates. The problem isn't with licensing, it's with the education of massage therapists. In regard to the A2 amendment, the AMTA has used this strategy to get to licensing in other states, using registration as a pathway. This happened in Wisconsin, where they started out with registration, and a few years later, it was changed to licensing. I oppose going down this slippery slope and would request that the AMTA work with those of us who oppose this bill to create a bill or amend 146A. I have testified against these bills in House and Senate committees for over a decade and have never been asked to participate in creating either a new bill or amendments to 146A. In closing, I urge the committee to consider the real-world implications of Senate File 1131 on our profession. Current statute 146A already safeguards clients while supporting qualified ethical professionals. Any proposed changes should not undermine those protections or create unintended gaps or burdens. Policy should be informed by evidence, practitioner experience, and the goal of safeguarding clients while continuing to support the dedicated professionals who uphold the highest ethical standards. Thank you for the opportunity to share my perspective. I would be happy to answer any questions.
Thank you. And last, we have Diane Miller. If you could please state your name for the record and begin your testimony.
Good morning. My name is Diane Miller. I'm an attorney. Actually, I'm a retired attorney now. I just deactivated my license as part of my retirement. I am one of the drafters of Minnesota 146A, and I oppose Senate File 1131, and I'm a co-founder of the Minnesota Natural Health Coalition. I appreciate the comment that Minnesota is different than other states, and I appreciate that the work that was done 20 years ago for Minnesota 146A was a very big paradigm shift. It was a new model of thinking about our constitutional rights to practice the healing arts. And we came up with a solution after 17 hearings that really tried to accommodate all of the issues around non-invasive, gentle, nurturing healers and the right of consumers to access them. And there is a Minnesota 214 with the constitutional basis. We gave you a handout on that. And we also have a 29-page document on our website for the reasons why registration and licensing of a non-invasive therapy is not the answer to the problems. I would also like to point out that one of your testifiers opposing this bill mentioned that Minneapolis is a model for working in Minnesota with cities. If the state said cities, instead of giving different regulations for all massage therapists for your educational, cities are trying to decide what kind of education they need. Cities can just adopt Minnesota 146A, the 27 paragraphs of prohibited acts, and the Client Bill of Rights, and they would be like Minneapolis, able to practice, and then the city still keeps their authority to give a business license with background checks and zoning issues. So licensing of massage therapists is not the answer to the issues of allowing consumers to have access to every kind of healer that they want. The one thing I'd like to point out in this bill that there was a massage exemption language for complementary and alternative health care. It was very poorly written, and it indicates that already, even in this current bill, the massage therapist proponents are already dictating what they think a complementary and alternative health care practitioner that they don't want to prosecute under the massage board would need to do in order to avoid discipline under their bill. They're already saying, you know, as long as you have a national certification.
Ms. Miller, if you can please finish your testimony.
Anyway, that's a slippery slope. Licensing is not the answer, and it's unnecessary, senseless, and it could lead to registration unnecessary government regulation of other therapies other than massage. Thank you so much.
Thank you. Members, now, do you have questions or comments about the bill? Senator Abler.
Well, thank you, Madam Chair. Sorry. Maybe this is the year. Finally, I think the version it's in now is a version that could pass. I think some people want more regulation, and clearly some people are afraid of any. We should have a caucus, Senator Hoffman, of previous carriers of the massage bill. And as part of a rehab time, we could sit together and think about what might have been. Just briefly, I know that I don't want to burn much time, but it is time to elevate this profession above prostitution, which is, there are people who are very not good at this, who do not deserve any credential, and the law will take care of them. And the cities have done their best to, in some cases, overcharge people at ridiculous fees and this whole patchwork thing. And we've upgraded the profession, so if you work in a clinic, you can't be bothered by the city thinking that the licensed professional would keep an eye on things. At least that's given them an outlet. But this profession is well-trained, and if they take the training. But there are people who have a nice little massage hut up in Pequot Lakes or somewhere who should not be bothered to have to do what they don't need to do. This is about informed public and informed consent. And so if you want to go to a person with a credential, then read their credential. And like, oh, they're registered, licensed, I don't care what. It seems like registered is the lower annoying threshold. I would be happy to have a voluntary license like we do in counseling, like we do in midwifery, lay midwifery. But whatever the version comes up at, it's got to be voluntary. There's no point to step on all those nice people who testified, and we're going to wind up not passing this again. So, Senator Hoffman, I think maybe you are the person to get it across the finish line. And so if it's one for the Gipper, it's time to recognize the value of these professionals. They are truly professional. They've got a ton of training. They don't hurt anybody. They know what they can do. And some people want to have the chance to have their insurance pay for it and all that. It's time. Thank you.
Members, other questions or comments? Senator Mann?
Thank you, Madam Chair. I think it's kind of crazy that we don't regulate this practice for the many reasons that we've heard from the people who are very well educated in this space. And it seems like the rest of the country agrees with that. It's a practice that uses words like stroking, gliding, lifting, jostling, percussion, compression, friction, soft tissue manipulation. And there's no license, no regulation for any of that for patients in rather vulnerable situations. So, and to say that criminal behavior is already illegal, so why have a license? I could make the very same argument that there is no need to license doctors or nurses either, because criminal behavior or criminal, it's already illegal to do anything criminal. But I would not ever want an unlicensed surgeon operating on me or an unlicensed nurse sticking a needle in my arm. But that's just me. And also, I want them to be licensed because I want my profession to be held to the highest standards. And then we heard that Minneapolis was a good model that works, so why change things? But we have a letter from Minneapolis asking for statewide consistency also. Yep. So I do think it's a shame that the bill was amended today. I think it weakens it significantly, although it is better than nothing. But I hope that we can come back and strengthen it. Thank you, Madam Chair.
I'm with you.
Thank you. Any other questions or comments? I don't see anyone else wishing to comment. Senator Hoffman, I have, I don't know, concerns or reservations about this. I mean, I think the positive that I'm looking at, if this is something that we could get done this year, is consistency and some consistent standards and some ability for those who wish to adopt, like city ordinances, gives them some consistent way to have personnel come into their city with a credential that's standardized. I think that's a positive. I think it requires training and education, and it does have a path for disciplinary actions, which I think the accountability part right now is not there. So I'm happy about those things. I do think that it leaves a gap, and not having something that's required across the state for all municipalities that don't choose to set up an ordinance, it does concern me. But I do recognize there are situations like this where we're trying to advance and make progress, and this seems like a way to do that this year. So I appreciate your work on this, and we do need to send this to the Judiciary Committee. And so there will continue to be discussion about it. Members, if you have other suggestions or ideas, I hope that you'll continue to talk about them with Senator Hoffman. So if there are no other questions or comments, Senator Abler moves that Senate File 1131 as amended be recommended to pass and be referred to the Committee on Judiciary. All those in favor, please signify by saying aye. Aye. Any opposed? The motion does prevail, and Senate File 1131 as amended is passed and referred to the Committee on Judiciary. Thank you. Senator Hoffman, you have one more bill, Senate File 1746.
Thank you, Madam Chair and members. This one is the Acupuncture and Herbal Medicine Practices Licensing Modifications provision that establishes that licensing side of it. It amends the Chapter 147B. It was heard and passed 2 years ago by this Senate chamber with the language that's here, but there's an author's amendment. The folks that have been working on this, so there's an author's amendment that addresses concerns that were raised in the other body. Once again, the Senate is achieving to the other body, but in that case, I think you might have the A2 in front of you, Madam Chair.
Yes, Senator Hoffman. So Senator Liskey offers the A2 amendment. This is an author's amendment. All those in favor, please signify by saying aye. Aye. Any opposed? The A2 amendment is adopted. Senator Hoffman.
Thank you, Madam Chair and members. And with me is Dr. Hillary Patzer.
Thank you for
Welcome to the committee. I'm sorry. If you could please state your name for the record and begin.
Yeah, thank you for having us. Thank you for the opportunity to speak to you today in support of Minnesota Senate File 1746. My name is Dr. Hillary Patzer, and I am here as a representative and as the president of the Minnesota Acupuncture Association. I am a licensed acupuncturist in Minnesota holding a clinical doctorate in traditional Eastern Asian medicine. I own my own practice in both Eagan and Minneapolis and have been the official sports acupuncturist for the Minnesota Vikings for the past 10 years and counting. I was also just in Italy treating some of the men's USA hockey players, go US, and serve on the Acupuncture Advisory Council. Today, my views represent only those of the MAA. Senate File 1746 represents multiple years of efforts for a grounded modernization of Minnesota's acupuncture and herbal medicine statute. This legislation is not about expanding scope recklessly or lowering standards. It is about updating outdated statutory language so that it accurately reflects modern education, clinical training, and healthcare integration. These efforts started via an outcry from the public over controversial verbiage in current statute. Minnesota's current law was written decades ago in the mid-1990s. Like all healthcare professions, we have evolved substantially, yet the language in the statute does not fully reflect that. Acupuncture and herbal medicine are practiced in contemporary clinical settings. When statutory definitions are vague or antiquated, they can create uncertainty about what falls within the licensed practitioner's scope. That uncertainty can affect reimbursement, interdisciplinary collaboration, and ultimately patient access to care. SF 1746 refines definitions to better align with current educational standards and nationally recognized certification frameworks. Clearer language strengthens patient safety by explicitly delineating professional boundaries and reinforcing referral obligations when conditions fall outside a practitioner's training. Clinically, acupuncture and herbal medicine are increasingly being integrated into care plans for various conditions, including but not limited to chronic pain, neuropathy, oncology support, women and men's health issues, neurological disorders, and stress-related illnesses. And further, in a time when Minnesota is actively addressing opioid reduction and expanding non-pharmaceutical pain management strategies, it is critical to clarify the scope of practice for practitioners. It is also important to note that this is not new or unvetted legislation. As you'll recall, we were passed by the House and Senate just last year. That version of this bill was also unanimously approved by the Minnesota Medical Board. The conversations have already occurred, stakeholders have provided input, and concerns have been discussed. This proposal has already undergone substantial review and collaboration. Bringing it forward again allows the legislature to complete the work that was nearly finalized. SF 1746 does not reduce oversight or eliminate standards. It modernizes language, clarifies definitions, strengthens alignment with contemporary clinical training, and improves access while maintaining safeguards. This is a responsible regulatory housekeeping with meaningful clinical impact. I respectfully urge for your support for Senate File 1746. Thank you so much for your time and consideration. And I want to note that Dr. Nick Doherty is not able to join us today for his testimony.
Okay, thank you. That's good to know. Mr. Zerwas, did you have testimony, or were you there? Are you ready to answer questions?
Holding my hand.
Madam Chair, I think Senator Hoffman missed me. I'm here available to help with questions. Dr. Doherty is kind of our subject matter expert on the legislation. He's been working on this language in conjunction with members of the Board of Medical Practice, other practitioners, and members of this body for over half a decade. And unfortunately, he's traveling for a professional conference, and he's in a TSA line as we speak and is unable to join us this morning. And so since our Acupuncture Association president hasn't been in the weeds as much on this, I'm here to help answer some of the questions and provide some historical context if necessary.
Okay, thank you. So we do have a couple other testifiers. One on Zoom, Stacy Hoffman. If you could please state your name for the record and begin your testimony. Thank you.
Sure. My name is Stacy Hoffman. I am the registered dietitian at Hennepin County Medical Center, but also I am here on behalf of the Minnesota Academy of Nutrition and Dietetics. I am the current president for MAND. We are the Minnesota affiliate of the Academy of Nutrition and Dietetics with approximately 1,000 members. We're the largest professional organization of nutrition health professionals in the state. Initially, MAND was opposed to SF 1746, specifically Section 10, which amends the Minnesota statute Section 147B.06, Subdivision 4, Clause 7, regarding the scope of practice for acupuncture and herbal medicine. We previously had concerns with the introduced language, but appreciate the recent amendment has addressed them. Our letter to the committee reflected those concerns prior to the amendment, and we want to thank Senator Hoffman and partners for working on the updated language. Briefly, I want to share where our concerns stem from and how the amendment resolves them. Our initial concern was the phrase allowing acupuncture and herbal medicine practitioners to provide dietary counseling using methods and techniques of acupuncture and herbal medicine. We found this to be unclear and could have been interpreted to include services reserved for licensed nutrition professionals in Minnesota under the statute 148.624. The ambiguity risked blurring professional boundaries and could have created confusion for both practitioners and patients. We propose clarifying language as you see in the amendment, in the A2 amendment, general dietary guidance provided for wellness and supportive purposes that is consistent with the education and training of an acupuncturist and herbal medicine practitioner. This change clarifies that practitioners may provide general wellness-oriented guidance within their training, while reserving the licensure protections around comprehensive nutrition assessment and counseling. MAND feels it better reflects the appropriate professional boundaries, avoids conflict with the existing statute, and still allows acupuncturists and herbal medicine practitioners to meaningfully support their patients. Again, thank you to Senator Hoffman and committee staff for incorporating this improvement. The amendment strikes the right balance. It allows acupuncturists and herbal medicine practitioners to provide wellness-focused support within their training while preserving public protections and professional distinctions around comprehensive nutrition care. MAN values opportunities like this to strengthen clarity across professions and to ensure Minnesotans have high-quality coordinated care. Thank you for your collaboration and for the chance to share our perspective today. I'd be glad to answer any questions. Thank you.
Thank you. And one other in-person testifier is Petra Brocken. Is she still interested in testifying? No, I won't be testifying today. Okay. Thank you. Members, questions or comments about the bill? Senator Abler.
Well, thanks, and I think it's a good bill, and it's the acupuncturists provide a really important niche. Insurance pays for some people pay out of their pockets, and it's quite meaningful. People are actually willing to pay for stuff out of their pockets that it's just good to have around. And the credentialing and the scope of practice, and I want to commend the dietitians and the acupuncturists for sitting down and hammering out some of the differences, and I think the final resolution is actually what they wanted to do anyway. And so thank you to that. And this is the kind of cooperation I think we need on these sort of bills. So, Senator Hoffman, away you go again. I don't know. It's
collaboration.
Pretty sweet.
Cooperation.
Any other questions or comments? No, I don't see any. I appreciate the work that went into this, the level of detail that you got to, and that you were, willing to make some updates and changes as needed. So I appreciate that.
Thank you.
Thank you, Madam Chair.
Any other? No, you're welcome. Senator Luskey.
Thank you, Madam Chair. Senator Hoffman, proud to be a co-author on the bill. Thanks for doing all the hard work. Acupuncture has definitely been overlooked at times, and I definitely look forward to these improvements for their scope. Thank you.
Madam Chair.
Senator Hoffman.
To that point, it has been overlooked. You came to visit me. There was, I had my left leg, couldn't I couldn't walk 8 months ago, but this acupuncture person showed up in my room, and I'm like, let's do it. The doctor was like, and oh my God, it does make a difference. It opens up whatever it opens up to be able to do things. So Hillary, it's a great thing that you guys do. So again, license scope, thank you for doing this, Madam Chair and members, and move it on to the floor. You miss me, don't you, saying that, don't you?
I do. Okay. I miss you in that committee, yeah. So Senator Hoffman, this one we will lay over. Okay. And so Senate File 1746, thank you for your work on this, is laid over for possible consideration. And now we will move to Senator Boldon. Senator Boldon, you have Senate File 3049.
Yes, Madam Chair, and I have the A1 amendment as well.
So Senator Boldon has the author's amendment, the A1 amendment. Senator Boldon moves the A1 amendment. All those in favor, please signify by saying aye. Aye. Any opposed? The A1 amendment is adopted. Senator Boldon.
Thank you, Madam Chair. So I'll talk about the bill as amended now. For over 45 years, Minnesotans have had the ability to see a physical therapist directly. Yet patients still encounter roadblocks, like the 90-day limit on care without a physician referral, extra appointments, and confusing rules when seeing newly licensed physical therapists. These obstacles don't make care safer for patients. In fact, they delay recovery, increase costs, and sometimes lead to more expensive interventions. This bill removes those outdated barriers. This bill eliminates the 90-day referral requirement so patients can continue receiving care smoothly without interruptions. It updates statute to reflect the education, training, and licensing of doctors of physical therapy. 74% of PTs in clinical practice right now have their doctorate, and MDH estimates that in the next 5 years, 100% of them will. It clarifies how physical therapists and physical therapy assistants work together to ensure safe, efficient care for the patient. And it strengthens title and term protection, allowing the Board of Physical Therapy to enforce rules and fines when needed. This bill does not expand the scope of practice. The role of physical therapists has been defined for decades, and their responsibility to refer patients whose conditions fall outside the scope of physical therapy remains unchanged. The author's amendment that we just adopted makes clarifications taken in part from many conversations with stakeholders. It clarifies and reorganizes the PTA supervision requirements. It strengthens title and term protections for PTAs and physical therapy and removes physiotherapy. It adds athletic trainers as providers whose practice is not considered physical therapy. It restores the failure to refer requirement for PTs to refer a patient to an appropriate health provider if the patient is not progressing. And it updates student supervision from on-site to direct supervision. So this bill allows physical therapists and physical therapy assistants to practice at the top of their license. It ensures patients get timely, safe, and uninterrupted access to physical therapy care. And with that, Madam Chair, I do have a couple of testifiers.
Thank you. And first we have, is it Professor Holly Clinch?
Yes.
If you could please state your name for the record and begin.
Yes, I'm Dr. Holly Clinch. I've been a licensed PT for 42 years, a doctor of physical therapy for 15 years, and a professor in physical therapy at St. Catherine University for 28 years. And I'm here today to speak in support of Senate File 3049. Excuse me. Physical therapists have been providing care in Minnesota since the 1950s when our scope of practice was established. We are more prepared than ever to deliver care via direct access. All PT programs in the U.S., including Minnesota's programs, are required to be delivered at the post-baccalaureate doctoral level with a minimum of 96 weeks of education, including a clinical portion of at least 30 weeks. Let me be clear, we do not make a medical diagnosis. We make a physical therapy diagnosis. In fact, we are required to do so by Medicare and many other third-party payers. Every physical therapy initial evaluation includes a review of the patient's medical history and screening for red flags, followed by tests and measures to assess the patient's functional status. We determine the impact of physical impairments, things such as decreased strength, pain, or impaired balance, on the patient's ability to move as desired. And we treat those impairments via physical therapy. Referrals are made for conditions requiring care outside of physical therapy or requiring consultation prior to PT. Our Code of Ethics and our Practice Act requires us to deliver care within our professional and jurisdictional guidelines. Our proposed bill does not change this, nor does it expand our scope of practice. It merely eliminates barriers for our patients who access our services. Please support Senate File 3049. Thank you.
Thank you. And now we have on Zoom Steve Burnap. If you could please state your name for the record, and you can begin your testimony.
My name is Steve Burnett. I'm a registered nurse at Mayo Clinic. I live in Rochester, and I'm here today in support of SF 3049. Thank you, Senator Boldon, for bringing this important bill forward. Physical therapy has been incredibly important to me as I live with multiple sclerosis. When I was first diagnosed at age 48, I was struggling with basic walking and balance. I was prescribed MS medication and sent home with a Tai Chi CD to help with movement, but they did not discuss physical therapy. My immediate condition of MS was addressed, but I did not get help figuring out how to move, function, or live well day to day. Physical therapy is what helped me with that. I trust my physical therapist has the experience to help me. They know my history, they know my body, and importantly, they know their limits. I feel safe seeing my physical therapist. If they detect something outside of their scope or related to my MS, I am referred to my physician or neurologist. That professional judgment has been clear from my first visit. Direct access means that I, and others like me, can get the right care we need quickly without a delay in waiting for a referral. Direct access cuts down on extra appointments and costs, takes pressure off physicians, and makes getting our needs met easily and efficiently. Thank you for your consideration. I encourage your support of SF 3049.
Thank you. And now I'd like to call up Loring Stead, or Steed, I'm sorry if I mispronounce your name, and then Lisa Matson. Welcome to the committee. If you could state your name for the record and begin.
Loring Stead. Chair and members of the committee, my name is Dr. Loring Stead, and I practice in Rochester, Minnesota for the last 40 years as a podiatrist and foot and ankle surgeon. I am testifying on the behalf of the Minnesota Podiatric Medical Association, which represents podiatric physicians across the state of Minnesota. We respectfully oppose Senate File 3049 for these reasons. This bill makes sweeping changes to the physical therapy practice. It expands the scope by granting physical therapists diagnostic authority while simultaneously removing important medical oversight protections. Specifically, the bill eliminates the requirement that patients receive a medical diagnosis before beginning physical therapy, removes the current 90-day treatment limitation, and removes supervised practice requirements for newly licensed therapists. Physical therapists are a valuable member of the healthcare team. However, they are not trained to make medical diagnoses. Their education focuses on rehabilitation and functional assessment. They cannot order MRIs, CAT scans, x-rays, and they cannot prescribe medications. A physical therapist's evaluation is not the same as a medical diagnosis. That distinction matters for public safety. A patient who presents with foot pain that appears to be a sprain may actually have a tumor. A partial tendon rupture treated without appropriate image can progress to a full rupture. A fracture that goes undiagnosed because no x-ray was ordered can lead to delayed healing, more invasive treatment, and worse outcomes for the patient. Our members already see situations where physical therapists operate beyond their scope of practice, managing postoperative wounds without surgeon involvement, disregarding surgeon care plans, or performing debridement without physician orders. Removing oversight will only increase these risks. For these reasons, the Minnesota Podiatric Medical Association respectfully asks the committee to oppose Senate File 3049 as written. Thank you for your time and consideration. I'd be happy to answer any further questions.
Thank you. And Ms. Matson, if you could please state your name for the record and begin.
Thank you. Madam Chair and committee members, my name is Dr. Lisa Matson, and I have the honor to serve as president, of the Minnesota Medical Association. With over 10,000 members across the state, we are the largest professional association of Minnesota physicians. Thank you for the opportunity to testify today in respectful opposition to Senate File 3049. Physicians value the important work of PTs. We work closely with them, and physical therapy plays a critical role in helping patients recover from injury, surgery, and chronic conditions. Under current Minnesota statute, patients are able to access physical therapy directly without a referral. However, the law includes an important guardrail. A physical therapist may treat a patient without a referral for up to 90 days, that's 3 months, but if the patient is not improving and treatment needs to continue beyond that point, the patient must receive an order or a referral from a physician. Persistent musculoskeletal symptoms can sometimes be the first sign of a more serious underlying condition, such as an infection, neurologic disease, or systemic illness, or in children, it could be a sign of a developmental disorder. These are best evaluated by a physician. Senate File 3049 would remove this safeguard by eliminating the requirement for a referral after the initial 90-day period. The bill also expands the definition of physical therapy to include diagnosis other than medical diagnosis. I'm not sure what that even means. The term diagnosis itself is not clearly stated in statute. Introducing this language without clear boundaries creates potential confusion about roles and responsibilities of patient care. Finally, current law includes additional safeguards for physical therapists in their first year of practice, recognizing that early clinical experience benefits from additional collaboration and oversight by a physician. Physicians, for example, complete 3 to 8 years of supervised residency training before practicing independently. Removing the early oversight by a physician raises concerns about the consistency in training and patient safety. For these reasons, the Minnesota Medical Association urges the committee to oppose Senate File 3049. Thank you for allowing me to testify. I'm happy to answer any questions you may have.
Thank you very much. Members, do you have questions or comments about the bill? Senator Abler?
Well, thanks. This is not a new proposal, and I'm sorry I missed Physical Therapy Day. It's nice when they stop down. I was gone I was just not around for the funeral that day or something. But anyway, just, I kind of went out of my way to commend the other groups that have found a way to find common ground. And I just advise the therapists. A lot of us are happy to talk about this, but it's just really meaningful that 3 or 4 major groups that actually, I don't work with a therapist day to day. I don't have one in my practice. I refer to one from time to time. We get along great. And that's great. My daughter-in-law is a physical therapist. And so very talented, and the training is certainly, well-founded. But just to state the obvious, I mean, when you get the Podiatrist Association, the MMA, the ACP physicians, and the orthopedists who actually would be, I think, amongst the most directly involved, all concerned about this, I think it's time just to keep working. And it was already brought up, but I do think the younger ones should really have a little bit of time. And just to poke at myself, when I graduated from my training, I felt really quite capable. I thought I was well trained. And after a year, I realized I didn't know anything. And so in humility, you get better with your practice, and particularly with the concerns. I would advise you all to keep working. I think there's a friendliness amongst people with opponents that would like to find something. But anyway, I just wanted to reiterate that. And I would, at some point, want to support something that can be well agreed to by all the people who know the day-to-day. Thank you.
Any other members have questions or comments? Senator Kupik, I'm sorry, I forgot.
We do. We look so much alike. Thank you, Senator Abler. Thank you, Madam Chair. So when I'm a co-author on this bill, and when this bill was brought to me, I was like, I have no idea what you're talking about, because I regularly, my wife and I, we're runners. I know you look at my very svelte physique and you go, of course you're a runner. But we regularly, occasionally we get injured and we have something, and we have some physical therapists that we regularly work with, and we take an appointment and we go see them. So I said, what are you talking about? That's because all of our living in Moorhead, all of our doctors are on the North Dakota side of the border, where they have the ability to do this. So this came as a complete surprise to me that you could not do this within the state of Minnesota. And I know certainly there have been cases where we've gone in and physical therapists, looked at some things and said, you know what, I think you have something else going on here, and then referred me on to a medical doctor. It is also very tough to get an appointment with your general practitioner doctor to go in and then to get a referral. So you have this waiting period, but there's also the waiting period of just trying to get in to see your primary care doctor, which is sometimes often impossible. And I will say, we've actually had things work the other way, where my wife went in to see a doctor because she had some hip pain, and the doctor just said, well, really nothing we can do, at some point we're just going to operate on you. And my wife was like, I don't like that answer. Can you at least send me maybe to a physical therapist? Which then the doctor did send them to a physical therapist, who then, with, here's a plan, the pain got more manageable and better. So it works the other way too. But the fact that, on a border state, that North Dakota, you can do this, it seems that we need to catch up with some of our neighbors and allow this. So thank you, Senator Boldon, for carrying the bill, and I'm proud to be a co-author.
Thank you. Any other members have comments or questions? Senator Boldon, I think the amendment, I appreciate the amendment, has some additional changes, like reinstating the discipline phrase about failing to refer a patient. It seems like that is good, that is reinstated. And I think it looks like the supervision has been changed to be direct supervision, which seems stronger. And I think I still have maybe some questions. I think the 90-day checkpoint, I can understand the barriers to getting appointments, and I'm not sure that I'm convinced that having that particular point in time is really helping patients when physical therapists do have this obligation to get a person to the right type of care provider when it's needed. And that should happen before 90 days if it's needed. So I do think that some of the changes seem like good ones, but I do also understand the concerns that have been raised about some of the terminology and maybe some of the supervision, but hope that you can keep working on it, and hopefully we can get closer together. And do you have any final comments or thoughts about it?
Thank you, Madam Chair and members. I appreciate the conversation. I will just say, I have much experience in working with physical therapists in both my personal life and my professional life, and they are a valued member of our healthcare team and provide excellent care and service to patients across the state and have for many decades. This bill does not change scope of practice. As you said, it maintains the responsibility for PTs to, make that assessment and direct patients to other providers if it is not within their scope, but it is aiming to sort of update and eliminate barriers for patients, and really that's the point of making things, improve things for patients, and so happy to continue to have conversations.
Great, I appreciate that. Seeing no other discussion about it, Senate File 3049 as amended will be laid over for possible consideration. And members, seeing no other business before us, we are adjourned.